I want to talk about sciatica. It's something that is pretty common. A lot of people have it. And most of the time when somebody comes in with sciatica to the ER, or because it's gotten so bad or they've had it for so long, they want to see what's going on with it, we do imaging of the spine. And we're looking at discs and foramen, which are the little holes in the bones where the nerves come out, and trying to see if there's any kind of pinching up in that area. We'll often see abnormalities on the MRI, which is what you need to see that area. And sometimes they correlate with where the patient's pain is, and sometimes they don't. It's pretty common that they don't. In fact, they can be on the other side. You have a narrow, tight space where the nerve comes out on the other side, and then you got, say, on the left, and then on the right, you have pain. So it's probably not because of that. So there are a couple other places, and if you just think generally from a regional standpoint, other places that the sciatica type pain can come from after the nerve roots that form the sciatic nerve come out of the holes in the vertebral column. They pass into the pelvis and across a muscle called the piriformis, and then out into the leg and down under the outside of your thigh, and outside on the back of your thigh. There's a muscle there called the biceps femoris, which I talked about in a prior post. So that's your sciatic nerve down to about 7 or 8 centimeters up from your knee. It splits into 2 nerves there. So anywhere from the spinal cord all the way down through the to where the nerve splits, you can have tightness and pinching or restriction of movement of that nerve. And any of those places can cause pain. So it gets kind of complicated if you're trying to fix it, but it's really not that hard. Once you start looking around, you can see things with ultrasound, you can push on muscles, you can watch the way that people move and kind of narrow it down. So is it at the spine? Is it in the pelvis? Is it in the leg? And why exactly is a person having these problems? Is it because the nerve is tied up? Is it because the muscle is pushing on it and tight and not moving right? Or is it higher up? Is it a disc or a spur, like a bone spur that pushes on it? So that's kind of a review of sciatica and where it comes from. Really frustrating for a lot of people. So if you've had an MRI that's normal and you still have the pain and you don't know what to do, give me a call. I can help you.